You're listening to The Mary Jones Show on the Talk of Connecticut.
Well, like it or not, and I personally, by the way, do not, it is the flu season. And here with us, I'm so glad to have a chance to speak with the medical director of Bristol Hospital's MedHelp Urgent Care Center, Dr. Joseph Cherneskie. Doctor, good afternoon.
Hi, Mary. Thank you for having me on.
Well, thank you for joining us. And I do want to mention, before we get to the flu and to influenza, Doctor, I was so impressed with the ribbon cutting, but more importantly, your brand new Beakley Breast Health Center that opened just a couple weeks ago. I was honored to have been there. What an amazing facility.
Yes, they've done a very nice job there, and I think it's really going to benefit the community and,
yes,
and the women in the area.
Absolutely. So congratulations for
Thank
that.
you.
Very, very exciting. So it is the flu time of year, Doctor. Like it or not, we have to accept that fact, I guess, don't we?
That's for sure, every year.
And that brings to mind, think about flu, you think about flu vaccinations. Your expertise tells you who should get a flu vaccination. Could you kind of lay it out for us?
Well, the simple answer is that all adults and children 6 months or older should be vaccinated every year. The vaccination to prevent the flu is particularly important for people who are at increased risk for severe complications from the flu. And honestly, the most important function of the flu shot itself is actually to prevent the complications of the flu, which are hospitalizations for pneumonias and other respiratory complications. Certainly, to get the shot to avoid the symptoms of the flu and missed work and school are important, but it's the complications in the high-risk groups that we're really trying to avoid, because this is where deaths and other bad things happen to people who get the flu. Certainly, there are many groups that are at particularly high risk and have to get the shot, and that's some of them are children aged 6 months to 5 years. Everyone 50 years and older should get the shots, and children and adults who have chronic medical problems, such as lung problems, asthma, COPD, other chronic illnesses like heart problems, liver problems, and diabetes. And the last group that you don't normally think of is women who are pregnant or may become pregnant during the flu season. They are at particularly high risk for complications.
Well, I bet, Doctor, that a lot of folks don't realize how serious the flu can be.
That's absolutely right, and as I said, the flu itself, though it makes you feel bad, gives you the aches, the fever, all that, it's the complications, the secondary infections that really cause the problems.
And I know certainly with, you mentioned elderly, but people who are senior citizens, boy, if they get the flu, that they can have very serious complications.
Oh, absolutely.
Yeah. So how many strains do we know? Each year when I hear about the flu, people always talk about there's 3 strains, there's 12 strains. Do we know how many strains of the flu there are this year?
Well, that usually pertains more to the injections themselves. Traditionally, each year, the flu shot contained 3 viruses, and the CDC and other organizations try to guess which viruses are going to be coming through the area. The difference this year, though, is there's also vaccinations that have a 4th virus in it to kind of increase the chances of hitting it right. So you don't know exactly what's going to be around until it gets here.
But the good news there, and we're speaking with Dr. Joseph Cherneskie. He is the medical director at the Urgent Care Center at Bristol Hospital. So there is an additional ingredient, strain in the vaccine this year than last year.
Well, each year there's two old viruses and 1 new virus in the vaccine. But the 4-strain immunization has 2 new ones and 2 old ones. So it depends on which vaccine you get. There's the 3-virus and the 4-virus vaccine.
Well, do you recommend one over the other?
Well, according to the CDC, they really don't recommend one over the other. Being that this is a new vaccine and a new year for this, they really don't have any long-term studies to say that it's actually better to get the 4-strain versus the 3-strain. So we usually just give out the 3-strain for right now, but the other one is an option.
It is, okay. And here we are, the middle of November, November 13th. Some people, I've already had my flu vaccination, so this is a good time if someone hasn't had it to get it, correct?
Oh, absolutely. You certainly would like to have it by November, but you never know when the flu is really going to hit. Sometimes it can come earlier, and sometimes it can come later. So even if you didn't get the flu shot and it's December, it's January, it's February, and the flu hasn't hit yet, you certainly should get it even at that time.
And what about children, doctor?
Well, children are very important because children under 6 months old are the pediatric group that is at the highest risk of flu complications. The problem is that they are too young to get the vaccine. So the best way to protect these very young children is to make sure that members of their household and their caregivers are vaccinated. And certainly the children that are over 6 months and older, they definitely should get their vaccine.
Okay, wanted to ask that just to make sure there's no confusion in terms of whether the vaccine is good for children, and talk about some of the ages. So having run down the group, if I can use that word, of people, doctor, who should be getting the flu vaccine, are there any people who should not be getting it?
Well, the reality is there's very, very few people that should not be vaccinated. Certainly people who have had a severe reaction to the vaccine in the past should not get it. And as I said, children younger than 6 months cannot get the vaccine either. Now, some people will say, I'm a little bit sick, should I get the vaccine? And usually if you're only mildly sick and you do not have a fever, you could still get the vaccine because you don't want to miss that opportunity. There are some medical conditions, rare autoimmune conditions and infections that people have, that they should not get the shot. But the truth is, except for children under 6, there are very, very few people who cannot get the shot.
I am such an advocate, doctor, of the flu shot. I never got the flu shot up until maybe, my goodness, it's probably 15 years ago at this point, and every year I would get the flu. And as you know, one can get the flu and be down for the count for a good 2 weeks. So I got the flu shot every year since then, haven't had the flu since.
And that's a good way to do it.
Yes, exactly. Now, the question that you probably get asked, and if not here all the time, can someone get the flu from the flu shot?
Mary, that happens almost 5 times a day.
Oh, really? I suspected that, doctor.
And the truth is you absolutely cannot get the flu from the flu shot. The flu shot itself, except for the nasal vaccine, all flu shots contain an inactivated or dead virus that cannot transmit the flu. The problem really is in the timing of these shots. Since these vaccines are given in the fall and the early winter, this is the time of the year where there are a lot of upper respiratory infections circulating, and you just happen to pick up one of these viruses by accident around the time you get the flu shot. But this is not the flu. And if you did not get the flu shot, you would have probably gotten sick anyway. And, some people will get maybe some minor soreness around where you get the shot, but other than that, you cannot get the flu from the flu shot.
And for the most part, you use the word minor. I would say, operative word is minor there, just in terms of, not anything at all that should deter anyone from getting the flu shot. Speaking with Dr. Joseph Cherneskie, he is the medical director at Bristol Hospital's Med Help Urgent Care Center, talking about influenza, talking about the flu. When was it? Was it the year 1918 that so many people died from from influenza?
Absolutely.
Yeah.
And a lot of lessons were learned from that, and that was really the advent of initiating the shots and really a public health measure to promote this.
I mean, just millions of people back
Sure.
then. I remember that, 1918, reading about that. The flu season lasts until what month, do you say, doctor?
It's really variable. Last year was a little earlier, but we've seen it be very busy into March.
And it takes about 2 weeks, is that correct?
Correct. And that's why we're pushing now for people to get immunized so that their immunity is set for when it does arrive.
So get the flu shot. Could I ask, I know we just have about 2 more minutes, doctor, but could you reiterate the people who, by all means and reasons, should make sure they get a flu shot?
Absolutely. Again, children from 6 months to 5 years old are very important. Every adult 50 years and older. Children and adults with chronic medical problems, asthma, diabetes, liver, kidney problems, people who have immune system issues, people that take chronic medicines like prednisone or steroids and some immunosuppressants that are used in gastrointestinal conditions and arthritis. Certainly HIV infection lowers your immune system. And like I said, the last group is the pregnant women or women that expect to become pregnant, and certainly to protect the children that are less than 6 months that cannot get the shot.
Dr. Joseph Cherneskie with Bristol Hospital. You know, we love the personal around here, Doctor. Can I ask you, what is your specialty within the field of medicine? Is it emergency medicine?
I'm trained in internal medicine, and I also have emergency medicine training, yes.
That's a fascinating specialty. It's
we see all kinds.
Yes, exactly. Well, I'm so appreciative of your time and your expertise today, and hopefully everyone is on their way to get a flu shot as we speak, Doctor.
Absolutely.
The website for Bristol Hospital is bristolhospital.org, bristolhospital.org. There is a link to it on talkofconnecticut.com. I put it up this morning. And phone number, 860-314-6046, 860-314-6046 for Bristol Hospital's MedHelp Urgent Care Center. And we've been speaking with the medical director, Dr. Joseph Cherneskie. Thank you so much, Doctor.
Thank you, Mary, for having me.
Have a healthy winter.
You too.
Thank you.
Bye-bye.
Yeah, I am such an advocate of flu shots, such an advocate. So it was great to be able to bring him on.